present another session related to nematodes. Okay, in the list of intestinal nematodes, I mentioned about Strongyloides estercoralis. Strongyloides estercoralis, or SS, is an intestinal nematode, but has specific features which leads to be mentioned as a unique nematode of human. After Strongyloides, we are going to talk about visceral larva migrants. It's a general term. I will explain to you. Toxocariasis, trichinosis, and anisakiasis. These are the subject of the nematodes for this session. Okay. In the list of soil-transmitted helminths, we talked about hookworms, Ascaris Trichiura, and Trichostrongylus species. Now we are moving to Strongyloides estercoralis. Strongyloides estercoralis, or SS, is known as a unique nematode of human because it has some specific features. One of them, which is very important, is capability of auto-infection, both internal auto-infection and external auto-infection. Okay, auto-infection in strongyloidosis leads to long-lasting infection in human, even for the whole life. When somebody is infected with strongyloides, okay, due to autoinfection, both internal and external autoinfection, the infectivity may last for several decades, okay? This is one of the most specific features of strongyloides. For example, in ascariasis or in trichuriasis, we don't have autoinfection. For every adult, it means one egg has been eaten. But here, when somebody is infected, it may remains the infectivity for whole his life. So, the other things related to strongyloides, they have free living generation. It means when the larvae hatch in the stool, they produce free living cycles. In the free living cycles, they have male and female new generation in the soil. So it is very important. They have free living cycle. The most important host for these parasites is human, but we have similar parasites in dogs and cats. But the main source of human infectivity is the other person infected with strongyloides. So we have Strongyloides estercoralis in animals, especially dog and cat, but the main source of population is the people infected with strongyloides. Strongyloidosis is very important for pre-transplant screening. In the pre-transplant screening, we need to make sure both recipients and donors are not infected with strongyloidosis. If somebody is infected and he is going to give the tissue, for example, kidney transplantation, the infection will be established in other person. So, strongyloidosis is one of the most important infections which needs to be screened before tissue transplantation. Right. This is the geographical distribution of strongyloidosis in the world. You can see we have the distribution in all the continents, but any part which has dark color, it means the prevalence is higher. So it is prevalent in tropical and subtropical areas like other soil transmitted helminths. But if the tropical areas and rural areas is accompanied with, for example, lack of sanitation, it is important as a criteria which leads to higher infectivity in the people. So, tropical area and also lack of sanitation and actually low socio-economic condition is important for the prevalence of this infectivity. This is a parasite which is important in rehabilitation centers because the ability of autoinfection. When the people in such centers are infected, they can transmit infectivity with other patients or even healthcare and personnel of the centers. So it is important in such centers. It is estimated that about 30 to 100 million people in the world are infected with these parasites. But true infectivity is much higher because most cases are asymptomatic. The people infected with estrangiosis, but they don't have symptoms, so most of them are missed. For the diagnosis, we need to do, for example, serological tests like ELISA. So the real cases are more than that it is reported. It is also coexistent with hookworm because the condition for the existence of these parasites is very similar to hookworms. It is also called as a nosocomial transmission because it can be infected in the centers that patients are living in. So when somebody is infected and they are asymptomatic, if they have immunocompromised condition due to the disease or predisposing disease or even corticosteroid therapy. So corticosteroid therapy and diseases which leads to immunodeficiency, they are cofactor for the severe infectivity with estrangiosis. You ask me a question about how the parasites migrate in the lung can spread to other parts of the body. This is the case. When somebody is infected with estrangiosis, due to immunodeficiency, they have a high rate of worm burden. After high burden and presence of too many larvae in the lungs and the congestion of the lung, some of the larvae migrate to the heart and through the blood circulation, they spread to any part of the body. So it is called disseminated syndrome. Disseminated syndrome, it means the presence of the larvae is not restricted to the intestine. It's not restricted only in the pulmonary system. They can be found in any tissues of the human, including heart, including the CNS, kidney, and other part of the body. So this case is called disseminated. If somebody has disseminated infectivity with estrangiosis, about 80% of them leads to the infectivity leads to this. So it is very important to find the infection at earliest stage and to have proper treatment. So estrangiosis is important in the people at the risk of actually tissue transplantation, and even at the people they are taking corticosteroid therapy or they have predisposing diseases. Let's see what are these predisposing diseases. Actually, any disease leads to immunocompromised condition. Some of them have been listed here. For example, malignancies are important. HTLV1. Does anyone know what is HTLV1? Have you heard about that before? HTLV1, which is called human T lymphotropic virus type 1, is a disease. If it is accompanied with estrangiosis, leads to severe complicated form of infectivity. During the pandemic of the COVID-19, people who were infected with severe infectivity with COVID and they were taking corticosteroid, if they had infectivity with estrangiosis, asymptomatic estrangiosis, the corticosteroid in such patients had actually chance to give rise to severe infection. So COVID also can be a cofactor Tissue transplantation like kidney, bone marrow, HIV at the last stage is important. Hypogammaglobulinemia, malnutrition, constipation, diabetes, alcoholism, cytotoxic medication, all of them are considered as a predisposing factor for complicated infectivity of the infection. Can anyone tell me what is the role of constipation? How constipation can have a low, actually, as a predisposing factor for complicated estherongenesis? What is related? What is the relationship between constipation and complicated estherongenesis? What do you think? We know about diabetes. We know about, for example, cytotoxic medication, or we know about corticosteroid. But what is the role of constipation? Yes. When somebody is infected with estherongenesis, okay, the development of the L1 larva, which is called rhabditoid, to infective form, which is L3 filariform. Usually it happens in the soil. It is called soil transmitted illness. But when somebody has constipation, the development of L1 to L3, which is filariform, which is infective form, is happening in the large intestine and colon. So during the constipation, there is enough time for the development of L1 larvae to L3 to infective form. So it is considered one of the cofactors for complicated estherongidosis. So estherongidosis estercoralis, like other soil-transmitted helminths, is prevalent in tropical areas. It is transmitted to human after contact with contaminated water, vegetation. The most important route of transmission is through the skin. The L3, L means larva. L3 larva or filariform larva penetrate the skin. But in addition of the penetration, if they are swallowed, they can also lead to infectivity. So both oral and penetration is route of infectivity of human with estherongidosis. But after infectivity, they can give rise to new generation because of internal autoinfection and external autoinfection. So that's the reason why this infectivity can remain in the persons for several decades. This is the life cycle of Estrongyloides estercoralis. The size of the female, parasitic female, is just 2 millimeters, just 2 millimeters. In the human body, we just have parasitic female. We don't have male. The parasitic female is parthenogenetic, or the mechanism of the production is parthenogenesis. Is anyone knows what is the means of parthenogenesis? Have you heard about parthenogenesis? When we have male and female of nematodes, if the female, for any actually organism, if the female reproduce without the existence of the male, it is called parthenogenesis. So any reproduction of the female without the actually contribution of the male is called parthenogenesis, right? So in humans, in the small intestine, there's just female parasitic Estrongyloides estercoralis, and it produce eggs without the participation of the female, so it is called parthenogenesis. The female is parthenogenetic, okay? So the female at the size of 2 millimeters, so there's lots and lots females in the severe infection. They are living in the small intestine, embedded in the mucosa. Once they are embedded in the mucosa, so the treatment is very difficult. The treatment is very difficult because they are not living in the lumen of the intestine. They are embedded in the mucosa of intestine. So they release eggs, but when the eggs are released, they are embryonated and they have a fully developed larva. So soon after the shedding, the egg has a fully developed larvae with a very thin shell. The shell is ruptured in the intestine, and L1 larva, which is called rhabditoid larva, is released in the stool. If the stool is spread in the soil, they can have free living cycle, or they can have direct life cycle like those of hookworms. Okay, if they are going to have the direct life cycle or indirect life cycle, it has different factors. It's not clearly known. It may be related to different actually substrain, or if they are happening in the tropical areas or other parts of the world. So we don't know exactly, but they may pass through direct transmission, direct life cycle, or indirect. Anyway, after fertilization of male and free living male and female, we have rhabditoid larvae develop to filariform. So in the parasitic form, in human body, we just have female, but in the free living cycle, we have both male and female. So suppose the human is infected through the penetration of the larva in the skin, like hookworms. They migrate to the pulmonary system. Although some of them may find the way to the small to other route of actually, for example, lymphatic vessels, but the most common route of migration is after moving to pulmonary system. So the larvae penetrate the skin, they migrate to the lung, they are actively moving in the lung, and after reaching to the trachea, passing the alveoli and reaching the trachea, they are swallowed, and in the small intestine, after molting several times and shedding the outer layer, they're developed to adults. This is the life cycle of Strongyloides. But here I want to show you what means internal autoinfection and external autoinfection. When L1 larva is released from the egg in the small intestine and they are going to shed in the stool, in some condition like immunocompromised condition that I listed to you, or constipation, in the large intestine and in the colon, they have nutritions, and after that they develop to L3 larva. L3 larva penetrate the intestinal wall and produce a new generation. This is called internal autoinfection, which is related to immune status of the infected patient. But what about external autoinfection? When the feces containing L1 larva is released, if the perianal area is infected with the stool, in the perianal area, L1 larva develop to filariform and penetrate the skin of perianal area. Because the parasite first has shed in the outside of the body and entered again, so it is called external autoinfection. External autoinfection is related to the behavior of the patients, to hygienic measures, but internal autoinfection is related to immune status of infected people. This slide is going to show you which part of the body is involved during the penetration of the larva, migration of the larva, and what happens in the small intestine, large intestine, autoinfection, both internal and external. Let's talk about clinical symptoms in strongyloides patients. About 30 to 100 people in the world are estimated are infected with strongyloides. Most of them are asymptomatic. The patients are infected, but they don't have any symptoms. Okay? But we have also other people who have severe infection, they have hyperinfection, When I say hyperinfection, it means they have a high load of the burden, burn burden. If hyperinfection is not controlled on time, hyperinfection leads to disseminated infection. And disseminated infection leads to death of 80% of infected patients. So we have asymptomatic patients, we have patients having complicated cases, they have hyperinfection, they have complicated cases involving, it means involving the other part of the body, for example, CNS. So, I mean the range of symptoms are very variable, but we can divide the patients in two groups. First group, the patients either are asymptomatic. If the symptoms are present, they are mild. Okay? They have intestinal symptoms because the adults are lives in the small intestine, and they may have cutaneous symptoms due to penetration of the larva through the skin. But the second group, those who are heavily infected with estrangiosis or disseminated estrangiosis, they have involvement of the bowel, they have skin disorder, pulmonary disorder, and also sometimes involvement of CNS and even other part of the body like heart. In the intestinal disorder, the patients experience abdominal pain, flatulence, nausea, intermittent diarrhea and constipation, malabsorption. Because of the small size of the parasites, 2 millimeter, thousand and thousand strongyloides will live on the mucosa of the small intestine, and in heavy infection, even the large intestine or colon may be infected. They may be found in the stomach and in the duodenum. So the normal site is the small intestine, but in the heavy infection, they may involve other part of the alimentary canal. So strongyloidiasis is one of the helmintic disease which may be misdiagnosed with many other diseases. In case of presence of intestinal symptoms, it may be mistaken with Crohn's disease or colitis, okay? Sometimes the patients experience biliary duct obstruction, jaundice, and even pancreatitis. So, when we have a high worm burden in the intestine, in addition of abdominal discomfort, the patients have other disorders, including severe anemia and malabsorption or steatorrhea. Have you heard about steatorrhea before? I'm sure you have heard. What is steatorrhea? Can you mention one parasite which leads to steatorrhea? You have heard before. Giardiosis, do you remember? Okay, giardiosis is parasitic disease. I mean any disease which leads to actually deficiency in absorption of the fat. So estrangiodiosis is one of the disease which may lead to malabsorption and then steatorrhea. Okay, this is going to show you the infectivity with severe strongylosis leads to inflammation of the actually intestine. And if we prepare a biopsy of the intestine from small intestine or in case of infectivity of large intestine, you can see the section of the parasites, larvae, and actually eosinophilic granuloma in the sample we have provided from infected patients. So granulomatous lymphangitis is common in such cases in severe infection, and patients experience the blood in the stool. If the bleeding is from the uppermost of the part of the alimentary canal, the color of the stool is dark. But if the bleeding is from the end part of the alimentary canal, we can see red color of the blood in the sample of stool. So ulceration, inflammation is found during the endoscopy in the infected patients. So we have intestinal disorder. The next is cutaneous disorder. Cutaneous symptoms is related to migration of the larva under the skin. This symptom is called larva currents because in case of the presence of animal hookworms, the larva cannot go further like animal schistosomiasis. But here they move actively under the skin before the penetration leads to inflammation of the skin, actually maculopapular or serpiginous urticarial eruption. It lasts about 1 or 2 days. It is mostly in the back, in the tummy, or on the legs, okay? So movement of the larvae under the skin leads to cutaneous symptoms which last a few days. Sometimes patients have intense red pruritic attacks, and in this case, urticarial petechial pruritic rashes. Some urticarial rashes is found in people infected with severe infectivity with esteromyeliosis. So, we have intestinal disorder, cutaneous disorder, and pulmonary disorder. Pulmonary disorder is related to migration of larvae of strongyloides to the lung. Why in case of strongylosis it may be so important? Because of autoinfection. Autoinfection may lead to the presence of thousands and thousands of the adults in the intestine, and a high burden of the larvae simultaneously are found in the lung. So some of them are swallowed, but some of them can lead to disseminated infection. This is the both of them, but especially in case of immunodeficiency internal. Such cases are mostly after predisposing factors, corticosteroid therapy, or the diseases I mentioned. Salam. Yes. You asked me about if the internal autoinfection are more important for severe subcomplicated exam. Most of the cases, at least based my own experience, any people are infected with such cases have the history of using corticosteroid therapy, which leads to faster shedding of the sheet, okay? So, internal autoinfection after predisposing diseases, and especially corticosteroid therapy has a very important role for disseminated infection. And I told you why such cases are prone to have disseminated infection because of the pulmonary ingestion, and some larvae do not have chance to be swallowed, and through the heart they disseminate to other part of the body. Okay, we have Loeffler syndrome similar to ascariasis. Okay, when we have temporary increase of intestinal, pulmonary eosinophilia, we call Loeffler syndrome. So estrangiosis like ascariasis may lead to actually inflammation of the lung, and pneumonitis and inflammation of the pulmonary system happens. In the imaging pictures, you can see bilateral infiltration. People experience cough, wheezing, chest pain. If they have sputum discharge in the sputum, we may find the larva of strongyloides. The larva may be found in the sputum, and in such cases, the larva may penetrate the pleura and then heart. Strongylosis is one of the most important helminthic disease, leads to hypereosinophilia. So, anytime we have invasion of internal tissues with the helminths, we expect hypereosinophilia. One of the most important helminthic disease which leads to hypereosinophilia is estrangiosis. They may don't have any other symptoms, but based on the laboratory findings, they have hypereosinophilia and elevated IgE. The other symptoms they have actually elevated IgE, occurred blood. We may find crystal of Charcot-Leyden crystals in the stool. They have fever, anemia, and weight loss. Here I want to show you what means hyperinfection. There are lots and lots parasites in just a small piece of the stool samples under the microscope. We say hyperinfection. So hyperinfection means exaggerated in the worm burden. This is the section of the intestine of a patient heavily infected with parasite. You see here, 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 and the granular reaction around the parasites or larvae and eggs. How do I diagnose that somebody is infected with estrangiosis or not? The history is important. Is he coming from endemic areas? It's important. Is he has predisposing factors? Hypereosinophilia is very important. In the CBS test, if you find hypereosinophilia, first you need to be suspected to the helminthic disease, and we need to have other tests. Parasitological tests can be used. Okay, I told you about disseminated infection. When the larvae migrate to other parts, they are taking the gram-negative bacteria leading to meningitis and septicemia, and some of them even this. So, for the diagnosis, we have parasitological tests, like direct examination of the stool, after sedimentation. There's a special technique which is called Bernan method, okay, using a funnel to collect the larva, examination of sputum to see if the larvae can be found. But even the examination of the sample from the duodenum, or instead of aspiration, we can use string test, okay? But among parasitological tests, the most efficacious method is culture of the sample, stool samples, or nutrient agar plate. You see, this is the agar plate culture of a stool infected with estrangiosis. We can see the larva tract, adult tract, the adults and larvae in the plate. So, agar plate culture is most sensitive among parasitological tests. But we have other tests like serological tests, especially for those they have low burden of the parasites. The stool samples, especially one single sample, is not enough to find the infectivity. Strongylosis is one of the most important parasites which has recently been applied for the use of PCR methods. But also many PCR methods have shown as important. They have high sensitivity and specificity, but they are not currently used in the laboratory. Just in some reference laboratory are used especially for the people who are going to have tissue transplant testing. All right. So we have serological tests, molecular tests, eosinophilia, and parasitological. I told you about endoscopy, imaging techniques, biopsy, and finding the parasite and eosinophilic infiltration in the tissues. For the chemotherapy, for the salt-transmitted helminths, I mentioned benzimidazole, albendazole, mebendazole. We have thiabendazole. Thiabendazole in the previous decades was drug of choice, but it has a large side effects. Currently, drug of choice for estrangiosis treatment is ivermectin. Ivermectin is known as miracle drug in hematology. Can you guess why miracle drugs? Miracle. You know miracle? Mu'jize. Yes, mu'jize. Or something leads to معجزه. Miracle drug. Actually, ivermectin has been discovered by two scientists, one from Ireland and other one from Japan. They worked in USA and developed ivermectin for the control of filarial infection and led to a very low prevalence of Bushra bancrofti. I'm going to tell you about that tomorrow. And for estrogen, currently it is drug of choice and much better than benzimidazole. So it is called miracle drug, like praziquantel, which was very good antihelminthic drug for the platyhelminths, for the nematodes, especially complicated cases of estrogen, ivermectin is recommended. Because of such important anti-helminthic drug, in the year of 2015, the Nobel Prize of Medicine was given to the scientists who discovered ivermectin. So it is very important for the treatment of the nematodes like filarial infection, psoriasis, even it is useful for arthropod diseases. If the patients have microbial infection, antimicrobial agents need to be used. For the prevention, it is like other sore transmitted helminths, actually sanitation, health education, providing safe water is important. But one of the most important, if somebody is going to have tissue transplantancy, we need to make sure he is not infected with S.U.M.S. Otherwise, use of corticosteroids leads to disseminated infection, and treatment of disseminated infection is very difficult. Nearly more than 80% patients at this stage cannot respond to antiparasitic drugs. Because of the presence of similar infection in the dogs, it is important to avoid the entrance of the dogs in the places that the children are playing. There are two other species, Strongylodes fulborni and Strongylodes fulborni cli, which has very restricted geographical distribution. Fulborni in Africa. In animals, there are rare cases in human. We just see eggs in the stool instead of larvae, and this is just in Papua New Guinea. So they don't have so much high prevalency in the world. If you have any question, ask me about Strongylodes. Otherwise, we are moving to another nematode. No question? You know, the larva in the large intestine from L1 develop to L3 and penetrate the large intestinal mucosa. Because it has not moved out and just inside the body, it is called internal autoinfection. Okay, I told you about Ascaris lumbricoides. Do you think only human has nematodes? No, animals has own parasites. Okay, when I say animals, especially animals are coming in the contact with human settlement. We have a specific nematode ascaris in animals. In the dog, it is called Toxocara canis. In the cat, it is called Toxocara cati. Okay? The life cycle of animal ascaris is like Ascaris lumbricoides in human. But what is the relationship with the animal ascaris with medicine? What we are going to talk about animal ascaris. What do you think? You see, animals are infected with their own ascaris. They are living in the intestine of dog and cat. The eggs are released in the environment. The larva develop to infective form, but human is living in close contact with animals. So the larva, when penetrate the skin of human, they cannot develop to adult because human is not susceptible house. If they penetrate the skin, the condition is called cutaneous larva migrans. So cutaneous larva migrans like swimmer's itch. Swimmer's itch is happening after swimming in the water, but here after walking in contaminated soil, infected with the feces of animals. So this is called cutaneous larva migrans by the especially hookworms of animals. But in case of ascarids of animals, when the egg is eaten, people, especially children, playing with dog and cat, if they digest contaminated water, vegetables, even during the geophagia, the egg of the Toxocara canis and Toxocara cati is digested by the people, especially children, and the larva is released in the intestine. These are going to show you the risk factor for ascarism, for actually visceral larva migrans. So if the larva penetrates the skin, we say cutaneous larva migrans. If the larva is digested, we say VLM or visceral larva migrans. The most important agent for VLM are the ascarids, nematodes of dog and cat. Toxocara canis in dog and Toxocara cati in cat. There are sandboxes in some garden. I don't know about in your country, but in some countries in Europe, it is very common to use sandboxes for the playing of the children. So if the dog and cat have defecation on such sandboxes, it is the source of infectivity for the children. Or contaminated water, vegetable, geophagia, or even eating the liver of other house like chicken, like sheep, which cannot develop Toxocara to adult, but the larvae is living in the liver. So if the liver is eaten as a raw food, it may be source of toxocariasis, especially adults. The adults get toxocariasis by eating the liver, but children by playing in with the contaminated soil or eating contaminated water and vegetables with the egg of Toxocara species. This is the life cycle of Toxocara in dog. The Toxocara can be infect the fetus during the pregnancy or through the milk. This is Toxocara in the intestine of dog. This is Toxocara cati in the cat. When they are feeding, they are infected. This is the egg of Toxocara found in the stool of cat and dog. Okay, so when the egg of animal ascarids enter the human body, human is not susceptible house. So they cannot develop to adult, but the larva invade different tissues and leading to the symptom which is called toxocariasis. So toxocariasis is a kind of VLM, visceral larva migrans. Any larvae of the helminths when invade animal larva, invade the internal tissues, which is, it is called VLM. But most cases, they are due to ascarids of dog and cat. So the disease is called toxocariasis. Toxocariasis is a kind of VLM or visceral larva migrans. The larva may invade liver, lung, brain. So depends on the site of infection. We have symptoms. Okay. Here you can see hepatomegaly. They may have pulmonary symptom, hypereosinophilia. The other disease which leads to hypereosinophilia is toxocariasis. If you have a child, he has fever, he's not responding to antibiotic, he has hypereosinophilia, you should be suspected with toxocariasis. especially if you have pet in your home. If the child is in the close contact with dog and cat, okay? So hypereosinophilia is very important in toxoplasmosis. The other symptoms like this one, skin rash, involvement of the kidney, and if I want to emphasize on the more common symptom, I told you about hypereosinophilia, fever is not responding to antibiotic, hepatomegaly, and pulmonary symptoms. The pulmonary symptoms are very similar to asthma. The physician may mistake toxoplasmosis with asthma. So we need to do CBC and serological tests. If we prepare a biopsy from the, for example, liver, this is the granuloma because of the larvae in the infected tissue. Sometimes the larva find its way to the eye. Most cases, just one eye is involved and presence. Even one larva, just one in the eye, it is very important. Presence of just one larva leads to ocular larva migrants. The children mostly infected at the age of, for the VLM, it is at the range of 1 to 5 mostly. But this one, the mean of the age higher, it's about 7 to 13 years. They have unilateral strabismus, it means crossed eyes, like this, crossed eyes, restriction of vision, and diffuse endophthalmitis or papillitis. See? So one eye is involved. They may have loss of even vision. One of the most important things about ocular larva migrans, it may be mistaken with retinoblastoma and leads to unnecessary inoculation of the eye. Okay, so it is very important to discriminate OLM from retinoblastoma to prevent unnecessary inoculation of the eye. So the larva, do you have any question? The larva may lead, as you see here, leads to the detachment of retina and infiltration of the. Sometimes the larvae invade CNS. Okay, so the patients have convulsion, paralysis, headache, irritability, and difficulty in sleep and epileptic attacks. Some cases, especially adults, you don't know if the larvae is in the liver, in the lung, in the CNS. The symptoms are general, like for example, anorexia, stomach pain, muscular pain, all of them are general. But they are seropositive. So in such cases, it's called covert toxoplasmosis, which is more common in adults, especially after eating infected liver of chicken or sheep. For the diagnosis of the toxoplasmosis in human, in children, do you think stool examination is useful? What do you think? Can we ask the laboratory to do examination of the stool to find if the patient is infected with toxoplasmosis or no? No idea, no. Why? The answer is correct, but I want to explain why. The parasite is in internal tissue and they are not developed to adults. There are no egg. There are no adults. They don't have any eggs. So stool examination is not useful. When we say toxoplasmosis, VLM, it means the larva of the animals has found in human, they cannot develop to adult, no eggs, so stool examination cannot be applied. What we should do in such cases? Serological test. Toxoplasmosis is one of the diseases which is not restricted only in tropical areas. It is important even in the developed countries. Why? Why it is important in developed countries? Pet. Because of the pet, exactly. So, toxoplasmosis is important even in the developed countries, especially the children are in the close contact in the dog and cat. So, because of its worldwide importance, there are many commercial kits. Serological kits can be used in the diagnostic laboratory, especially ELISA. ELISA is common serological test, but for the confirmation and to make sure they don't have cross-reactivity with other diseases, Western blot tests can be applied. But the ordinary method are ELISA, and there are specific commercial kits with a high sensitivity and specificity. The other things, clinical symptoms can be useful: hepatomegaly, hypereosinophilia, and in case of the involvement of the eye, we can use ophthalmologic examination to find the larva in the actually eye. Liver biopsy is not used, and it should be differentiated from other diseases, especially the diseases leads to hypereosinophilia like fascioliosis, staphylococcus. Okay, you may be concerned if you have, for example, pet in your home. Now you are concerned what we should do. How you can find if your pet dog or cat is infected with Toxocara? Because in the dog and cat, they are living as an adult stage. Exactly. Can you tell why stool examination is exactly? You see, in the dog and cat, they are living as an adult in the intestine. So, stool examination. Tomorrow, I'm going to show you the adult Toxocara, the egg. So, just by a simple stool examination of the dog and cat, you can make sure if it is infected or not. This is the adult Toxocara. Sometimes they are found as a vomiting. They may have vomiting, or the egg are characteristic and can be found in the stool. For the treatment I mean in human. Also in animals you can use benzimidazole. For any antihelminthic drug, I say like ivermectin, benzimidazole, we have specific types to be used in the veterinary. Right. Most cases are self-limited. It means they will be resolved, so they don't need any treatment. But for severe infectivity, the ones are actually leading to pulmonary disorders and the child is feverish. Corticosteroids is important to reduce the inflammation, but the antihelminthic we have because they are the larvae of the nematodes. So benzimidazole is also important. Albendazole, mebendazole, thiabendazole, and ivermectin. There's another antihelminthic drugs like diethyl carbamazine, which is mostly used for the pleural infection, but we can use for any of these is available, but not for the OLM. For VLM, for the OLM, use of only antihelminthic drugs leads to higher inflammatory reaction. So steroids is important. Use of steroid is either local or systematic. Then we use the antihelminthic chemotherapy. It should be in combination with use of steroids, either local or general. Sometimes we need to do surgery or vitrectomy to remove the granuloma and the larva, or the granuloma, which is fine even without the larvae, and rare cases they need to do surgery. For the prevention, they are among soil transmitted animals which are transmitted to human through close contact with animals. So health education is important for the actually stray dogs, stray cats. It will be their population under control. Do not let the animals actually arrive in the parks areas. Children are playing. Cover the sandboxes when they are not in the use, and proper washing the vegetables, and also health education is important. In case of pet dogs, they need to be treated with antihelminthic drugs every 6 months intervals. No question so far? Okay. Let's move to another nematode, which is called Trichinella. Trichinella have several species. Trichinella spiralis is one of the widespread species of Trichinella. The disease is trichinella disease. As you see, people get infection with this parasitic disease after eating the meat of the pig containing the larva in the muscles. This is the muscles of a pig. This is the larva encysted in a cyst. When such pig is eaten, the people get infected with trichinellosis. Trichinella is a helminth which is widely distributed in the nature in animals. Okay? In addition of the human, many animals can be infected with this parasite. Even in the Islamic countries, although we don't have usually human reports of the trichinellosis, but it may be happens in the wildlife. Okay? So the patients who are hunting the boar or their family are at the risk of infectivity. Like sodium, the human cases are not prevalent in the Muslim because they don't use the pig. But it is one of the most important helminthic diseases in all of the world, in European countries, in Western countries, Africa, South America, any place that the pig is used. So in addition of the sodium, trichinella is important in such population. Let's talk about clinical picture in the people infected with trichinella. When human digests the muscles of the pig containing the larva, in the stomach, the larva is released. The larva develop to adult, male and female. After copulation, the female release larva, not egg. It means the larva, the development of the eggs is happening in the uterus of the female. So the eggs are released and invade the intestinal tissues, and through the circulation they have migration. When they settle in the muscles, they mature, actually they produce a cyst, and they can remain in the cyst for several months. When such cyst of the animal infection is eaten by human or any other host, they get infected with trichinella. So human or animals, when they get infected with trichinella, they have both adult stage and larval stage. Adult stage develop in the intestine, larval stage phase migrate in the bloodstream, but only in the striated muscles they are going to be encysted. So encysted larvae in the muscles, migration through the blood circulation in any part of the body, adults in the intestine. So we have intestinal phase. In the intestinal phase, the symptoms are very similar to food poisoning. Then have actually diarrhea, colic pain, sweating, fatigue, vomiting, nausea. In the larval migration, when the larvae is migrating in the blood circulation, they have inflammation, hypereosinophilia. Another helminthic disease leads to hypereosinophilia is trichinellosis. They have facial and periorbital edema, like this case, fever, and splinter hemorrhage. At the last stage, when the larva encysts in the muscles, the patients have a severe infection, actually myalgia. For the diagnosis, serological tests, they are commercial pig and kits for the diagnosis of trichinellosis in human. The treatment, like other nematodes, is use of benzimidazoles, albendazole, and mebendazole. For the prevention, cooking meat of the pig properly, and avoid actually hunting the boar. I don't know if your country is common to hunt the boar. Do the population have this practice? Hunting the BOAR, boar. Does it happen? I mean, for example, in my country, we don't have usually cases of trichinosis, but some people, the hunters of the wild boar, are at the risk of infectivity. We have a rare cases of human infection with trichinosis after, because we don't have actually domestic pig. But in addition of the pig, dog, and wild animals are infected, but usually human is not going to eat, for example, dog. But the boar is a source of infectivity. That in the hunters and their family are at the risk of infection if they use the meat of the wild animals like boar. So, yes, for any products by the pig or the boar, the family of the pig is called pork. That's the meat of the pig and other animals in the same family. Pork. Like beef. Beef means related to cattle, not like beef. Beef means related to cattle. Pork means related to pig. Pig products. Pig products. You see, pig products. So, cooking the products of the pork is important, and meat inspection in abattoirs. Any question about trichinosis? Okay, you are not worried because you don't eat pork. Okay. The last nematode in this session I'm going to talk about is anisakiasis. Actually, anisakiasis is a disease of nematode which their larvae is happening in the tissues of fish. Okay? So, the life cycle is happening in the aquatic mammals. Fish get infected with the larval stage. One of the most important dishes, which is the source of anisakiasis, is sushi. That one of you told me that you are interested to taste sushi. Excuse me, you may be at the risk of the anisakiasis infection, especially if the sushi is provided by the fish which has not been inspected for the larva of anisakis. Anisakis is a helminth which the larvae is in the fish, different species of the fish. And the aquatic mammals are acting as definitive host. So this disease, anisakiasis, is mostly prevalent in Japan, first Japan, and any other countries which such fish is infected, leading to the presence of the larvae in the throat, in the stomach, in the intestine. Okay? So, I don't know why sushi is so famous and many young children like you, they want to taste sushi. Sushi is an example. Any food which is prepared from the fish containing the larva of anisakis is the source of infectivity of human with this disease. For the actually diagnosis, again, stool examination is not useful. We need to have history. History is important. We need to make sure if they have used raw dishes prepared by the fish like sushi, sashimi, and other food. Immunological tests, radiology, sonography, endoscopy is important. In the endoscopy, we can see the larva. For the treatment, during the endoscopy, removal of the larva is important, surgery and chemotherapy with benzimidazole. For the prevention, fish cutting and deep freezing is important to kill the larva. Okay, yes. Just larvae. They cannot develop to adult in human. Serological test to see the larva during the endoscopy is helpful. History is important. Have he just recently eaten, for example, sushi? But endoscopy is one of the common mode of diagnosis. Even the endoscopy can be the actually means of treatment to remove the larva. Pardon? No, they are not. They cannot develop. When human eat the muscles containing the larva, they may attach in the pharynx, in the stomach, in the intestine. They cannot develop to adult, but attachment of the larvae in the tissue leads to inflammation. Okay, I show you some clips related to decision. We have to finish this session earlier, but how many times we have left? Just 10, 15. Okay. Right. Today, no, we don't have time for MCQ. We just answer the question. How can I just come back one slide? Excuse me. I just want to come back one slide. Larva of Anisakis.
Same package.
Yeah, that's going up on YouTube. And then right there, and that goes to right there.
It's a whole case of the same.
This is ocular larva migrans. Larva of animal nematodes in the eye of a patient. This is the egg of Strongyloides containing the larva, a fully developed larva. This larva is L1, which can develop to L3 both inside the body or in the soil. This is filariform larva, infectious. L3 filariform larva, which is infectious for human. This is the larva found in the stool examination of patients infected with strongyloides. This is L1 larva. Strongyloides is among nematodes which we can see the L1 larva in stool examination. Instead of egg, the larva is found in the stool examination. This is the endoscopy of a patient infected with strongyloides. This we can see inflammation, redness of the mucosa of the patients. This is the egg of Toxocara, which has been when it is eaten by the children. After hatching, this larva invade the internal tissues, leading to VLM or toxoplasmosis. All right. So you're happy that you're not going to have MCQ, but I just answered the question, okay? Because we have shortness of the time and we will be faster. First question, a patient after hospitalization and corticosteroid therapy for COVID-19 disease revealed intestinal disorders